Hi guys. So this is going to be the first video in a series that I'm starting for my PTA program. This is going to be all the joints and their motions. So in the first video, we're going to start out with the pelvis and the hip. So to start out with, we're going to do flexion and extension. Okay. So flexion, we're going to be looking at the hip joint, right? So flexion is going to be whenever we're bringing that leg forward, right? This is flexion of the hip. Extension is going to be the exact opposite. So what we're going to do, so looking at this joint, we're going backwards, extending back. Extension, flexion. Okay. The next motion that I'm going to do for the hip is abduction. Abduction. Abduction is going to be taking the hip, moving it away, right, for the foot. So you're going to be here, we're going to be going out, away from the body. This is abduction. The next movement is adduction, okay? So the complete opposite of abduction. Adduction, you want to think about you're adding into your body, so you're moving back into your body, right? So if the starting point is an abduction, adduction is going to be that movement coming forward. So I'm here. This movement is adduction, moving into the body. The next one is going to be external rotation. So with external rotation, still focus on this joint here. We're going to be rotating out. So we're kind of rotating that hip posteriorly to the back of our body. Internal rotation is the exact opposite. So what we're going to do is we're here, we're going to be rotating in, okay? We're bringing that joint in. So you want to think about kind of going to, rotating toward that other hip bone. So you have external rotation, internal rotation. The last one, well, two, that we're going to do, we're going to start out with anterior pelvic tilt. So the anterior pelvic tilt, let me looking from the side here. Whenever we're anteriorly rotating or anteriorly tilting the hip, what we're going to be doing is we're going to be focusing on, if you touch your hips, you're going to feel a pretty big like curvature, right? So we're sitting right here on the top of our hips. We're going to be focused on this bony part of your hip. So what you're going to do is we're going to take this part and we're going to kind of push backwards. So you kind of see me like pressing my butt back. Here is tilting forward, right? Opposite, posterior, you're going to kind of shift forward here. You kind of think that it's opposite, but it's not. So I'll show you again, right? So anteriorly is we're pressing the butt back, coming forward here. So remember, we're focused on this bony structure. Coming forward or anteriorly. Posteriorly, complete opposite. Coming back and shifting back as much as you can, right? So the structure is going posteriorly to the back. So we have our pelvis or acetabulofemoral joint.